Your crush is so mind hitting record on our session.
Yep, I was just about to ask you to can you want to start over again?
Yeah, good morning, everybody. Welcome to Falls Free Friday. Appreciate you joining us this morning. My name is Elizabeth Head. I am the Deputy Director for Injury Prevention at Georgia Department of Public Health. We are so pleased to bring you this Friday's installment of Falls Free Friday. Dr. Lisa Freyer will be presenting a couple of housekeeping items for you before we get started. We have these sessions each Friday in September. They are not put on by one person. The Georgia Fall Prevention Task Force, which is co-led by the Injury Prevention Research Center at Emory and the Department of Public Health. We work together along with partners from across our entire state to bring these sessions and these professionals to you. We are so grateful for our friends at Cobb County Library System, Shepherd Center, our friends up in Gainesville, Mercer University, again, the Injury Prevention Research Center at Emory, and so many others that take their time and talent and really do a lot of work to get these sessions on for us. So we're so grateful for that. Today's speaker is no exception to the amazing people that we count as lucky to have as a partner. Lisa is a clinical assistant professor in the Department of Physical Therapy. She received her Doctor of Physical Therapy from Mercer University and her Bachelor of Arts from Emory University. She's working to complete her PhD studies in physical therapy through Texas Women's University. Dr. Freyer is a board-certified clinical specialist in pediatric physical therapy and with nearly 10 years of clinical experience practicing in pediatric home health, school-based, and aquatic settings. She teaches the pediatric content in Mercer's Doctor of Physical Therapy program, and her research focuses on disability bias and health inequities across the lifespan, also community participation for children with disabilities and disability attitudes in healthcare. She's an active member of the American Physical Therapy Association, APTA Academy of Pediatric Physical Therapy, and the APTA of Georgia. With that, I will turn it over to Dr. Freyer. Good morning.
Good morning. Thank you so much. I'm going to get my presentation pulled up here. If you bear with me for just a second. Okay. Whoops, sorry. I thought I was better at Zoom than I actually am. I will share my screen first and then I can get to where I need to get.
No worries at all.
Okay.
Looks great.
Okay, great. Awesome. Okay, thank you for that lovely introduction, Liz. I appreciate it. Not to repeat too much, but just to kind of reiterate, I am a physical therapist. Specifically, I work with children, all types and ages, 0 through 21, and I am board certified in pediatric PT. I'm also an educator, and I'm a parent. I have 3 young children, 6, 4, and almost 2. So I can speak on this really important topic from a place of education, but also a place of experience, because as we all know, children fall a lot. And our goal here is to talk about the different types of falls and give you some strategies to help prevent the more serious falls in babies and young children. So I've designed this presentation to be interactive, so I'm going to be asking some questions throughout, so please feel free to unmute and chime in, or if you have any questions as I go through, please feel free to interrupt me and ask away. So I just came up with a couple of objectives for you all. I'm hoping that you will take away these things from this presentation. So I want you to be able to pick out things that will increase a child's risk of falling and being seriously hurt. I would also like for you to be able to understand things that you can do to help limit the risk of serious falls for children in different environments. And we're going to talk about different environments where falls occur. And again, please feel free to interrupt if you have any questions. All right, so the first thing we're going to do is talk about falls in general and help you kind of understand what I mean by different types of falls. so that we can talk about prevention strategies with us all being on the same page. So firstly, I wanted to reiterate the importance of this issue. According to the CDC, accidental falls are actually the #1 cause of non-fatal injury that leads to ER visits in the United States among both children and adults. So this graphic that I have here for you actually looks at data from the CDC from 2020, specifically related to children between the ages of 0 and 4. Each rectangle represents a different type of non-fatal injury for this age group. And then the larger the rectangle, the more that contributes to the overall rate of childhood injuries in this age group. So you can see pretty clearly the orange square is the largest, and that represents falls. There are some other types of injuries that are also listed on here, and you can kind of look at those as well. But clearly, falls are the biggest contributor here to childhood injuries that wind up having the child go to the emergency room. So I wanted to talk just a minute about good falls versus bad falls. So does anyone have an idea what the difference is between the cluster of photos here on the left and then the cluster on the right? Any thoughts about? Yeah.
Height from the ground?
Okay, so that's definitely going to be a factor when we talk about injuries that result. Any other thoughts? Okay, so somebody put in the chat the risk of falling on their head. Yes, that's also going to play a role in the severity of the fall. What I was going for here is that you can think of falls in two ways in this age group, right? There are falls that we would consider to be part of typical development, meaning that as children learn and they develop new skills, they're going to be challenging their balance, right? So you can see the picture number 3, there's a little girl who's learning how to sit up for the first time. And she, when children learn how to sit, they're going to fall over. When children learn how to walk, they're going to fall over. Same thing with running or more advanced skills like riding a bike. These are falls that are part of the developmental process. They need to have those losses of balance to be able to figure out how to prevent that from happening in the future. That's how they learn, basically. These falls also don't wind up with them needing to go to the hospital because they're not seriously injured. They may wind up with a bump or a scrape, but nothing, potentially life-threatening. The cluster on the right are falls that are not considered to be part of typical development. So the one on the top is of a baby falling off the bed, and that is not part of learning how to maintain your balance at that age, right? Maybe an older child would be able to be in a bed and rolling around and prevent themselves from falling off the side, but that's not really expected of a child that little. Same thing, picture on the bottom where the child is climbing a piece of furniture. Now, yes, climbing is developmentally appropriate, but being able to jump out of the way of a television falling on you when you're 2 is really not something that's part of the normal developmental process there. And these 2 injuries also will wind up with the child needing to be seen in the emergency room at the very least. So the reason why I included this slide is because I don't want you to think that all falls are bad. Some falls are good in that they're necessary, right? And we can't prevent children from falling completely, otherwise they would never learn. But we are trying to avoid those falls on the right where the child might wind up seriously injured. Okay, so now we're going to talk about where falls happen. So out of these 3 options, home, the daycare center or preschool, because we're talking about children birth through 4, and playgrounds, where do you think the most falls happen in this population? Okay, I see home in the chat, all of them. They definitely do happen in all of those places. Emma was correct. Home is actually the most frequently or the environment where falls happen the most frequently in this population. Okay, so this is something that somebody touched on a little bit earlier when they were talking about the difference between those pictures. We can describe the type of fall that the child experiences by talking about fall height. So there's something called a same level fall and something called a multi-level fall. So a same level fall is basically where the child is on a surface, right? So let's say they're just standing and they trip over something and they fall down. They are already on the surface on which they're falling. So the distance is not going to be very great, right? They're not falling a significant amount down, right? Versus a multi-level fall where let's say they're at the top of the stairs, or let's say a small child like an infant is being held by their caregiver who is 6 feet tall, and now they're falling a greater difference. They are not currently on the same level as the ground they are going to impact, okay? So that's the difference between same level falls and multi-level falls. And then similar to that is the idea of a low level fall versus a high level fall. So low level falls are typically considered to be anything less than about 3 feet. And there are also, medium level falls. We don't need to worry too much about that. High level falls, on the other hand, are considered to be falls that are greater than about 20 feet. So this is where we think about things like falling out windows. And we will talk about those later on. But the idea here, and the reason why I wanted to point this out, is that even low level falls can cause serious injury. So it's not necessarily the distance that is completely controlling the resulting injury. You can have a child who is young and they may not fall that far, but they could become seriously injured. The other thing that I wanted to point out when we talk about falls is that there are a lot of different fall surfaces that the child will fall onto. And those can change with age because the child's mobility is going to change, right? So if we think of an infant, they start out kind of on the ground, they're rolling, they learn how to sit up, and then they eventually start to stand. Once they move on to the walking phase, that surface will change as well, and there will be lots of different types of surfaces. So when they're younger, they're usually more independent and exploring on softer surfaces. So let's say they're on a rug or, some other floor in your house that's kind of protected. As they get older, they start to encounter lots of different types of surfaces. So it can be cement, mulch, grass, wood floors, tile floors, all different types of surfaces as well. And then once they get to that phase where they're able to start running and navigating stairs, that surface is changing too. So we see that the surface on which they fall is also going to play a role in injury. Okay, so there was a study that was done recently that looked at data from the 3 Children's Healthcare of Atlanta hospitals related to falls for this age group. So we're really lucky because we have data that's actually specific to our geographic area and looks at the CHOA hospitals. So they found that the majority of falls were from a low height. So that's that less than about 3 feet. But the majority of falls were also multi-level. Meaning that children are not on the surface already that they're falling onto. So they're falling down basically multiple levels. They found that children were more likely to be younger that experience these multi-level falls. And that typically makes sense because children who are younger are being held more often than children who are older. And we're going to talk about that in a minute as well. And they found that children with the most severe injuries were younger. This is our infants, okay? So less than 1 year old. They were able to take all the data and identify some risk factors that made children more likely to experience these serious falls. And this included a younger age, being male, and having Medicaid as their primary insurance. I also wanted to put a little note in here because I am a pediatric physical therapist. I wanted to just say that children may also be at an increased risk of falling and hurting themselves if they play without supervision frequently, just because they have the ability to get into things that we may not anticipate. And I really want to emphasize the importance of supervision. I'm a mom of 3. I know it's really difficult to supervise your children at all times, but coming up with safe places for your child to be when you're not able to directly supervise them, and we'll talk about some strategies for that as well, is really important. But the other thing I wanted to mention is that if the child has a medical condition that affects their balance, you may see them falling and hurting themselves more frequently. So if you think that your child is falling more than they should be, I would really advise you to talk about it with the pediatrician and voice your concerns and make sure that they're taken seriously, because often falling frequently is the first sign of some different types of conditions that children can develop in childhood. Also, if children have ear infections frequently, that affects their balance as well and could result in falling. So there's lots of different causes, and they may or may not be, too concerning, but it's always good to talk to your pediatrician if you feel like they're falling more than they really should be. So there's my pediatric PT plug. All right, so now we're going to talk about the causes of falls, and we're going to break them down into different age groups. So we're going to start with infants. This is children less than 1 year. And they found that the majority of falls were from a caregiver's arms. And this could be multi-level if the caregiver is standing up, or it can be same level if they're, sitting down on a surface. So they looked at this is all, again, still from that same study from the CHOA hospitals, and they looked at different ways a child might fall from their caregiver's arms. The bulk were from the parents' arms, but I also thought it would be important to note here that it wasn't just from the parents' arms that was an issue. They also found that children were falling while being held by another child. Some were falling while they were being carried on the stairs, which I know was always my biggest fear as a new parent. When I was carrying my first child up or down the stairs from their bedroom, that was my biggest fear there. And then 12% about were falling while they were being carried in an unbuckled carrier. So think of like a car seat or one of those baby seats or bouncers. They were being carried in that while it was unbuckled. And then the smallest proportion were falling after a caregiver fell asleep with the child. So either on the couch or on a bed. And then they also looked at falls from furniture, which are considered to be multi-level falls. And they found that most often they occurred from the bed. And then they found that there were quite a few, about 60% of them falling from a counter or a table, and also from a stroller. And again, these are children who were placed in this equipment on the counter or the table. So let's say you come in from the car and your child is in their car seat, and you put that car seat on your kitchen counter or your kitchen table. Those children were falling within the car seat off of the table. And then from the stroller, those children were not buckled. Okay, so we're moving up to toddlers now. I always joke with my PT students that this is the age where children are always just getting into total mischief, lots of trouble. They're exploring everything, anything that they can possibly get into, they do. They're very curious at this age. And so, and they're very mobile now. Okay, so at this point, children are typically walking. They may even start to climb. And that's where we worry about falls in this population. So a lot of times these falls are from furniture. And so we talked about the bed and the couch, but also now in this age group, chairs, because they're able to sit in chairs or stand on chairs. Also high chairs and shopping carts, because now they're at the age where they're being put in those devices for meals or, when you run errands. And then stairs and windows become a problem more towards the 18 months to 2 years range in this age group. But basically, as they become more mobile and they're able to start climbing, this is where they're going to start being interested in going up and down the stairs and climbing up on windows, like you can see in that picture that I have there. This group also still falls while running, slipping, or tripping. And yes, it is appropriate for them to be engaging in those activities. And most of the time when they do fall while they're walking or running, it doesn't wind up with them needing to go to the emergency room, but sometimes it does. And then if we look at the last age group, which is this 3 to 4 years, here's where you see a lot of multi-level falls. Now they're bigger, they're stronger, they're exploring more. When they go to the playground, they're starting to engage in things like the monkey bars, which is a big fall risk piece of equipment at the park. It's super fun. I love the monkey bars. I also supervise my children heavily while they are on them. This picture is actually of my son. He's 5 here, so he has mastered this skill a little bit. But I just wanted you to kind of see how high they are up off the ground and how it's very easy for a child to fall down from them. Other surfaces of the playground that start to pose issues are swings, right? Children like to jump off of them, or sometimes they can fall off of them, and slides as well. And we're going to look specifically at some pictures of playground equipment when we talk about prevention. Furniture is still an issue here in this age group. So we have beds, chairs, and couches, and trampolines. This is where children start to be interested in and able to play on those large trampolines that people have outdoors. So that's another place where a lot of children are falling and injuring themselves. Stairs, again, because here they should be able to go up and down the stairs on their feet on their own. And then windows pose a risk in this population too. Same thing as with the toddlers, you do see some same level falls from running and slipping and tripping and all that stuff. And yes, they should be doing those things. And yes, they typically do not wind up putting them in the emergency room, but sometimes they do. Okay, so now we're going to talk about the different fall-related injuries. There are 3 kind of common groups here. So we have head injuries, and those can range in severity. So things like a mild concussion, all the way to actual skull fracture or brain bleeds. We also have broken bones. So we think of broken arms and broken legs most commonly. And then cuts. And this can be something as simple as a scrape, or it can be, a deep cut that they get if they fall onto something or if they hit something on their way down when falling. So this same study found that there were differences in the most common types of injuries that occurred because of a fall based on these different age groups. So in infants, they found that they had more severe head injuries. In toddlers, you saw more broken legs and concussion, so less severe head injury. And in preschoolers, they saw more broken arms and concussion. Does anyone have any idea why we might see a difference in the most common type of injury by the different age groups, why there would be a difference there? Okay, so access to different activities, yes, for sure. You're not going to see an infant playing on the monkey bars. So that definitely plays a role. Any other difference between the children? Yes. Okay. So somebody said developmental differences in how they fall. So the idea here is that older children are stronger. They have smaller heads relative to the rest of their body, and they have developed the ability to start to use their arms, especially to catch themselves when they're falling. So this is why you see in the older age group, that 3 to 4, where those reflexes have developed really strongly because they're older, they've had time to develop them. You see children bracing themselves with their arms when they fall, same way we would, right? You go to fall, you put your arms out to catch yourself. So you see in the older age group broken arms because they're able to quickly put their hands out, but the force coming down through their arm, they can't always tolerate it. And that's why you see these children fall from the monkey bars and break an arm, for example. That's a very common injury. As you start to get younger, their ability to do that, to catch themselves, is less, right? Because they haven't had time to practice and develop those reflexes yet. The other thing is that head size relative to the rest of their body is larger the younger they are, right? So infants, for example, have the highest or the largest head size relative to the rest, and weight relative to the rest of their body. They also are the least developed in terms of reflexes or ability to catch themselves. They don't have any. And their muscles are not as strong and developed, especially in the neck region and the trunk region, as the older children. And so what happens is you see them hit their head a lot more when they fall, versus the older children are able to prevent that from happening by using an arm or a leg or something to catch themselves first. So this graphic just shows you kind of what I just talked about with the different age groups. So if we look at the light blue, these are children who are under 1, and you see the biggest resulting injuries are skull fracture and intracranial hemorrhage, which is a brain bleed. You see some femur fracture, which is leg, but mostly you're seeing those more serious head injuries. As you move into the next age band, the toddlers, those orange and gray bars there, they show you that most commonly they have leg fractures and then concussion, so milder head injuries. And then ages 3 and 4, so that's the yellow and the dark blue, you see the biggest there is those broken arms, and then those mild head injuries as well. And that's just basically because of the developmental differences in their bodies and their reflexes. Okay, so when a child falls and has to go to the emergency room, there are a couple of different options for treatment. They can be treated in the emergency room and sent home. This is best case scenario. They can also be admitted to the hospital, and there are different tiers as well there. So they could be admitted to just a general floor, or they may need to go to the ICU, or if they're in a situation where they need surgery, then they would go to the operating room. And then these are some of the common medical procedures that they found in that study that children would have after a fall resulting in injury. So including things like neuroimaging of the brain, there'll be MRIs or CT scans, or they may also need to have x-rays of their bones if they suspect a broken bone. If they do have a broken bone that needs to be repaired surgically, they may need orthopedic surgery. If they do have something on the neuroimaging that requires surgery, they may need to have neurosurgery. And then typically the children who are more severely injured may wind up needing to be intubated, but that's really for the most severe type of injuries. Okay, so we got all that out of the way. So now we kind of understand the scope and the gravity of the problem and why it's so important that we are here trying to prevent children from those serious falls. And so the next part of this is going to focus on how we're going to prevent children from falling. So what I did is I took the common causes and then I listed some strategies to help limit these risks for falls. So in terms of infants, we talked about falling from the caregiver's arms and falling from furniture. So as far as caregivers' arms go, do not allow children to carry infants. It's just safest that way. And do not carry an infant in an infant container. And what I mean by that is any type of device. So there's a couple of different pictures here that is made to put a child in and made to be stationary. So if a car seat is being used to transport a sleeping baby, let's say, from the car into the house, you can safely carry the child in that car seat from the car into the house as long as they're still buckled, because the car seat is meant to be safe while the car seat is moving. These different pieces of equipment here, so this is an activity center, image 16, or I think we all are kind of familiar with those baby bouncers where they kind of sit and they bounce like that. There's all different types of infant sitters where they are kind of shaped like an animal and you just basically stick the baby in it and they sit there. those are not made, they're not designed to be safe while that baby container is moving. So it's really not safe to carry the child while they are in that, because they could fall out. So for example, if we have this lovely little child here in picture 16, and I need to move this activity center to the kitchen because I have to cook dinner, the child needs to come out and be put in a safe place. So maybe on the floor or something like that. And then I carry the container to the kitchen, and then I put the child back into it. It is not safe for me to just pick the whole thing up and carry it to where I need to be. This gets harder as children get older. So I don't know that's something that somebody would do with a child that big anyway. But you see this a lot with little babies, especially if they fall asleep in something, that parents will just pick it up and try to carry it to another room. And that's really not a safe practice. And then I think we all hear this a lot, but do not sleep with infants on the couch or in the bed, because if you fall asleep, then the child could fall out of your arms and onto the floor. As far as furniture goes, always use buckles to secure children. And this is in high chairs, carriers, strollers, anything that has a buckle is designed to be used with the buckle. I know I myself get lazy sometimes, and I'll just stick my kid in a high chair and put the tray on top and not buckle him in, but that's really not safe practice. He very easily could pull himself out of it and fall. Okay, so you always want to make sure that you use buckles. Use shopping carts that are designed for children if possible, if you have access to them and they're available. So that's that picture 15 up there that you can see an example of one. And those also have seat belts, so use them. The reason why I recommend using these is because they're actually built where the seat is deeper down and the sides are higher. So there's less chance of the child kind of moving side to side and, reaching for something, let's say, and falling out, than if you had the traditional shopping cart where there's, the seat up top. The sides are really much lower. And so there's a much greater risk of them, leaning and falling out. The seat belts are also placed very strangely. They wind up like right, here. And they're kind of easy for children to slip out of because they're not down at the waist. So again, if you have access to this child type shopping cart, I recommend using those instead. You want to make sure that you're securing heavy furniture and TVs to the wall. And so this is going to become a lot more important as you reach the toddler phase. But if you have a child who is more mobile and starts pulling up to stand at 9 months or 10 months, which is very possible, then those could become risky as well. Also, avoid infant walkers. So that's the picture 17 there. The American Academy of Pediatrics is actually calling for a complete ban on infant walkers due to safety issues, because what's happening is parents are putting children in them and children are pushing them down the stairs, which results in very, very serious injury. So because so many children are winding up in the emergency room from falling with one of these infant walkers, the American Academy of Pediatrics is just wanting people to stop using them altogether. Okay. The other thing is never step away from a child if they're on a high surface. So this is where you see things like changing tables become really risky. Those changing pads actually have buckles on them, or they should. And so you should use the buckle, but also that's not necessarily going to keep the child in place if you step away. So just making sure that you always have a hand on your child, and if you need to get something else, take them off, put them on the floor, go get your thing, come back. And always place infant containers on the floor. So if you have a bouncy seat or one of those infant sitters or something, it needs to be on the floor. It really should not be on the kitchen counter. Even a car seat should not be on a kitchen counter or a table or something like that. For toddlers, this is where we see windows start to become really dangerous here, because they're very curious. So make sure that your windows are locked and closed. If you're like me, all of the windows in my house are painted shut. So we don't have to worry about this one too much. But if you're lucky to have windows that actually open, this is where you can install something like a window stop, which is the picture 18 there, those little white things that basically allow the window to open a little bit so you can get some breeze. But they only allow it to open, 3 or 4 inches, not far enough for the child to actually get through it. They also have window guards, which basically looks like a baby gate for your window if you live somewhere where you're up really high and you're really concerned about the child being able to get out. Also, keep furniture away from the windows because this just promotes access to them. Children could potentially, depending on the kind of window, break the glass and fall through the window itself too, even if they can't actually open it. During play, make sure that the child's always using helmets if they're using a wheeled ride-on toy. So a bicycle, a tricycle, a scooter, whatever, make sure they're wearing helmets. And then if possible, you want to encourage active play on something that's going to absorb the shock if they do happen to fall. So things like rubber surfaces, mulch, turf, sand, grass can be deceptively hard. So yes, it's better than cement because you don't get that friction. So if they fall, they might not get a scrape from grass, but the impact, the ground underneath can still be pretty hard. And so if they hit their head, let's say, it can still cause some serious injury there. And then this is the age group where they start to want to use the stairs and be able to use the stairs on their feet. So this is where safety gates really become a good thing to have in the house, and they need to be installed securely. So they've got those ones that you can kind of, open and shut, and they just kind of pop into place, and then you can take it down and put it in a closet or something. And they also have ones that really are more permanently fixed into your wall or your staircase. And obviously the ones that are permanently fixed are going to be safer. I've seen my own children really want to get through a baby gate and just completely push it over. So making sure that they have baby gates and that they are secure is important as well. And then again, thinking about things that children are supposed to be doing developmentally, children should be learning how to use the stairs at this age. And so I'm not saying you need to carry your child up and down the stairs every time. You shouldn't. You should be letting them try and figure it out for themselves and learn, but just making sure that you're assisting them and supervising them on the stairs. And then we have our oldest kiddos. These are the preschoolers, the 3 to 4-year-olds. Here's where furniture poses a risk. And so making sure that your TV and any like large dressers or other furniture that they could climb or they could try to open and pull down on themselves, that they're secured to the wall. And making sure that windows, again, are secure and furniture is away from the windows. During play, same as toddlers, they need to use helmets and encourage active play on those shock absorbing surfaces. And they actually recommend that you avoid trampolines. Now, I know that this can be hard because I feel like lots of people have trampolines and my children have lots of opportunities to play on trampolines. I don't let my younger ones play on them. My older one can, but you can kind of evaluate too the safety of the trampoline. The one in the picture here has this nice net around it. So the chances of the child falling off are smaller. They still can, but it's a little bit safer than some of the ones where it's just a giant open surface. So kind of thinking about risk there too. And it's safer to just avoid trampolines altogether, but there can definitely be degrees of safety involved there. And then for stairs, this is where children should be pretty independent on the stairs, but you still really should be supervising them and use baby gates. If you can't supervise them, then don't allow them to have access to multiple floors. Okay, so I wanted to take a couple of minutes to just look at some pictures here and try to identify some fall risks. So I have pictures of different environments, and what I want you to do is just assess different qualities or features and see if you can pick anything out from these pictures that may pose a risk for a serious injury from a fall. So the first setting we're going to look at is playgrounds. I have a lot of playground pictures because I have a lot of feelings about playground safety. So that picture on the left there, picture 21, what jumps out at you all there that could cause serious injury if a child were to fall or poses a risk? Yes, awesome. So there's no appropriate mulch under the slides. So this is where, yes, there's grass, so it's better than if this were on cement, but the ground can actually be pretty hard underneath, even though there's grass on top of it. And so if they were to fall, they could seriously hurt themselves. What about picture 22? Any ideas? Yeah, so the low sides on the slide are a little concerning to me. Typically the sides are a little bit higher to kind of create more of a groove for the child to stay in so they don't fall off the side. Yes, there's no railing. So where the dad is standing with that child, there's no railings there. Now that height is not too far off the ground. Whereas like if the child is on the dad's head, so that's probably not a safe place to be doing that. But if the child were just standing on that platform, they probably would be okay if they fell, but it would make me concerned to see, okay, if they don't have any rail there, I wonder what it kind of looks like up at the top and how much railing and safety supports are on that side. Somebody said you're going to burn yourself on that metal for sure. Yes, these are the slides that I grew up with, the metal ones. So the surface is not great when you're coming from a skin integrity or a burn perspective. But somebody else pointed out it is too high. It is really high. This is quite tall because this, dad, if we're assuming he's 5'10" is average height for a man, and then he's got a kid on his head, and this is probably at least 3 feet off the ground. I mean, this has got to be a 10-foot slide. And there's really not much going on up at the top if you look. So if you look at the picture on the left, you have those little, metal sides kind of at the top of the slide. And the idea is that forces the child to have to sit down before they, go down. They can't really be standing and kind of fall off in that transition. Up here, all there is a metal bar, and a child could very easily just duck their head under the metal bar and continue to stand up at the top of this platform because there's no kind of roof to it, if that makes sense. So I would be very concerned that a child could be up this tall, 10 feet off the ground and slip or whatever and fall off and get seriously hurt. Or hit the metal bar. Exactly. Okay, let's look at some more slides. What do you think about this one on the left here? How do we feel about this one? Okay, we've got some likes for this one. I agree. I think this is pretty good. Here's a great picture of those deeper sides. And this is a 5-year-old boy here. This is my son. And you can see that it goes all the way almost to his armpits, to his shoulder. So he's really nicely seated in there. It's got that kind of roof covering that forces them to sit before they go down the slide. And it's got this really nice, I don't think it's turf. It's that like rubberized playground surface there. So this one's pretty good as far as it goes. Yes, definitely a cushioned ground surface. What do you think about rock walls? Let's look at this rock wall here on the right. How do y'all feel about that one? Yes. Okay. So I love rock walls from a motor skills perspective. I think they're wonderful for coordination, strength, and they're fun and they encourage exploration. Like there's so many benefits to them. This one in particular makes me really nervous, and I wish I had a person standing next to it so you can see. But if you look at the picture on the left, this rock wall is actually just to the right of that slide that you can see in the left picture. And there's a man kind of standing next to the structure. So it gives you a little bit of perspective there of how tall this is. I can tell you that when my children go up rock walls, I'm always spotting them from behind, and depending on how good they are at them, I typically have a hand on their bottom. So if they come off, I can, push them to the wall and stop them from falling backwards. I can't reach, and I'm not a tall person, but I don't know that a tall person could even really reach once they get up towards that top third. And yes, thank you for pointing out, Brandy, this one has this little bench next to it. And this bench is made out of plastic, but still, if the child were to fall off, now not only are they going to have to, fall, but they could land on something that could seriously hurt them. So it's not even a safe falling environment as well. So the other thing that makes me nervous about this one is that because of how they designed this play structure, there is a bunch of tunnels that children climb up. And what happens is they go through this tunnel here that you can see in the back, and then they quickly kind of turn and they go across this bridge to the slide that's in the picture on the left. And if a child is trying to navigate the transition from coming off of the rock wall to standing up on this structure, I've seen children almost get pushed off. And then that's very dangerous because they would be falling backwards with some force off of this, kind of opening. So I'm always really hesitant and closely supervise these transition spots on playgrounds because this is where children fall and really hurt themselves. And I'm going to show you another example of that now. So on the picture on the left, we see here's this ladder thing where the child's supposed to climb up it and then kind of bridge this, 2-foot-ish distance to get to the platform. And this is another one where, if they're climbing up, it may not be as big of an issue because they're kind of coming from a lower place to a higher place. But if the child is coming up to this area and again stands here and is kind of looking out and somebody bumps into them or they slip or whatever, now they're falling down. This is very high off the ground, and now they're going to potentially be hitting themselves on this ladder as they go down. So I worry more about the kids who are already up there getting pushed than a child falling off of this ladder per se. I don't think I have a good picture of one in this presentation, but fireman poles are another place where children wind up getting pushed and falling and really hurting themselves because it's just a big open high height, or children don't actually know how to do the fireman pole and so they just fall. So those need supervision and you really need to be confident in your child's abilities. And if the playground's busy, I just tell my kids, we're not doing that today. Sorry. Fireman pole's closed or rock wall's closed or whatever. Yeah, someone shared that their daughter took a flying leap and fell. Yep. Kids are trying out all different types of things and they're not always, good choices. So for sure, I'm very wary of these types of things on the playground. Here's a picture of a better rock wall because I wanted to share one. I like this. It's wider and it's lower to the ground. It's not as high as that other one. The other one probably went all the way to the top of that bar up there. So I feel very confident in my ability to supervise and assist my child on this. And if they were to fall, I would feel like I could catch them. Here's some more slides because you see I have lots of issues with slides. The one on the left, the slide isn't really the issue itself. It's these stairs. It's not a great picture because I'm too close, but these are really tall, hard stairs. And if a child were to fall backwards, so they turn around to say hello to somebody or something and lose their balance, now they're falling down this, 10-foot, 12-foot high flight of stairs. And so this slide always makes me nervous. I typically tell my kids that they're not allowed to play on that one because, or I follow them right behind. The picture on the right shows you some good examples of some good slides. I love the tube slides. It's really hard to fall off of a tube slide. And this one here as well has really deep, it's really deep and it has this nice bubble that forces them to sit down. So it's less of a fall risk. Somebody was talking about the surface that these are on, that mulches on these types of playgrounds are never deep enough for the fall heights. Yes, 100%. They're not maintained either, as you pointed out. And yeah, you can even see in these pictures where the ground is or the mulch is kind of ground down and it's really just dirt. They say that you're supposed to have 12 inches in order to accommodate that height. So, okay, we're going to move along because we're running out of time here. So that's slides. Whoops. Here's a picture of a living room. Again, make sure the TV is fastened, use a baby gate. This would not really hurt or not really feel good if a child fell off. So maybe putting something behind the couch to prevent that. Another example of a bedroom this time, using buckles on this. You can see there are none here, so that's not really a safe changing table. There's furniture right next to the window, not safe. This should really be anchored to the wall, so making sure that that's anchored. And same concern here with the furniture being next to the windows. Here's some pictures of unsafe stairs. Again, baby gates not being used. They're cluttered. There's push toys near the stairs, just not safe environments. I wanted to finish quickly with how to respond to falls. So hopefully you're able to prevent them and you don't have to worry about this, but in case you do, if a child experiences a serious fall, and this means a fall of greater than 3 feet if they're under 2, or greater than 5 feet if they're 2 and up, you need to seek urgent medical attention. If you see that the child appears to be seriously injured, do not try to move them. You can actually make their injury worse. Call 911, follow their instructions. I had a good friend's child fall off of a playground structure, fireman pole. He got pushed, and he landed on his back. And her husband is a doctor, so she knew not to touch him, but she immediately called 911. He was hysterical. He was saying his back hurts. Those are all very good signs that there's something seriously wrong and that the child needs to be seen urgently by a medical professional. If the child appears to be unharmed from the fall, so let's say it's not one of those serious fall heights, and you check them out, you kind of assess, you see how they're doing, and you don't think that they are harmed, still it's good to call a pediatrician and just alert them to make sure that there's nothing you're missing. My daughter once was in her high chair and the leg just broke clean off, and she was 8 months old and she fell still in the high chair. So luckily the side of the high chair took the brunt of the impact, but then her head hit the floor and I was terrified. But luckily, because the high chair was not really that high, it didn't count. It wasn't higher than 3 feet. It wasn't one of those serious falls, but I called the pediatrician anyway. And she talked me through it and made sure everything was okay and gave me some tips on things to look for and follow up. And she was fine, thankfully. But it's important to know that signs of brain injury can actually show up hours or days later. So just because the child seems to be okay in the moment does not necessarily mean that they're off the hook. We need to make sure that we're still monitoring for things like headache or dizziness or blurred vision. Or even if the child is just not themselves, they're just extra fussy or extra tired, or they just seem off, contact a healthcare provider, have the child checked out. So I want to leave you with this caveat of this is meant to be informative, but if you are with a child who experiences a fall, please don't pull this presentation up and refer to this. If you're ever in doubt whether the child is hurt or not, just call the pediatrician, take the child to the emergency room, or call 911, just kind of based on the child and the situation, because every child is different, every situation is different, and it's always better to seek help and it not being that serious than to not seek help and the child really needs it. And that's it. Sorry, I did not leave much time for questions, but if anybody has any questions, I'm happy to stay and answer those.
You're totally fine. Lisa, thank you so much for your time and expertise today. Please feel free to unmute and ask any questions you might have for our speaker. We do have just a couple of minutes. A lot of great information presented today. Okay, well, Lisa, thank you so much for your time today. We really appreciate your time. We are going to be posting this on the Injury Prevention Research Center at Emory's webpage here in the next few days. We have quite a following of folks that are viewing these recorded sessions. So we thank you for giving that out to the folks that are doing that and when they can't attend live. For everyone, including our speaker, please have a wonderful Friday, a great weekend, and stay safe. We look forward to seeing you in our next installment of Falls Free Friday. Bye, everybody.